Hello, good afternoon, everyone. So, welcome to yet another Facebook Live session with me, Dr. Sneha. I am a fertility consultant at Oasis Fertility, Pune. So, today we have a topic. We have decided to come up with discussing the advanced IVF techniques. So, one of the topics that we use is to treat DNA fragmentation. So, what is DNA fragmentation or DFI? So, what is DFI, sperm DNA fragmentation index, and what are the treatment options when the DNA fragmentation is raised in the sperm test? So, first of all, let's understand. When we see some background of a case. So a couple comes up to us and we have investigated them. They have been to multiple IVF clinics and all of their reports have come back as normal or near normal. In spite of that, they are unable to conceive. So somehow this falls into the category of unexplained infertility. Now, even in unexplained infertility, we have assessed only the surface layer where the couple has undergone a basic panel of investigations, which includes the sonography in detail or a 3D sonography of the wife and a semen analysis of the partner. This also includes their hormonal profile, where some hormones which influence the reproductive system have also been studied. In spite of these panel of tests, there hasn't been anything substantial which can be pointed out and can be terminated as the reason for being unable to conceive. So this falls under the category of an unexplained infertility, where we have to go a bit lower than the surface and dig deeper to find out what could be the probable cause of an unexplained infertility. So, apart from this, what are the conditions where we dig deeper and we suggest to go ahead and check for a sperm DNA fragmentation index? So, other cases than an unexplained infertility, there are some other cases also where sperm DNA fragmentation index also becomes mandatory. So, first is unexplained infertility, like we discussed. Second is if a lady is conceiving, but the conception or the pregnancy is unable to continue beyond a certain period within her first trimester, and she is having unexplained recurrent abortions. So, where even in the blood test of that we do for investigating why a lady is having recurrent miscarriages, there also we haven't come to any concrete evidence or a concrete reason to support that okay, this is the probable reason why she's having recurrent abortions. So this another reason is that a couple who has done some simpler treatments for their fertility like IUI. So IUI is a procedure, is a simple procedure where it's almost natural method, but some amount of support or some amount of boost is given on both the partners' ends so as to increase their chances of conception by around 20 to 25 percentage. So recurrent IUIs have also been done where the follicular rupture is happening properly, the endometrium development is good, the tubal patency has been checked, and the sperm tests are also normal with respect to the count and motility of the sperms. So, in spite of all these things, multiple IUIs have been done, and there hasn't been any result so far. The last and not the least is a couple who has undergone IVF treatment also, where there is a good quality of embryo formed with day 5 or blastocyst formation has happened. Then the endometrium is also optimum. But in spite of this, in spite of any known reason or any evident reason, there is no particular reason why that IVF should fail. So, such recurrent implantation failures is also one of the things where the DNA fragmentation should be detail investigated. So let's understand that what is DNA fragmentation. So to give a backstory or background, the sperm production in humans takes place in the testes, and it takes around 60 to 80 days. So during this 60 to 80 days, what happens is there are some germ cells or the primordial cells which subsequently undergo through various changes to form a mature sperm. Now, this entire process of 60 to 80 days is a time taking process, and there are multiple factors which influence this process. So the sperms, the head of the sperm in particular, has the genetic material. So this genetic material, that is the DNA, is in a tightly compacted ball form. So this compacted DNA, when is ejaculated or the sperm travels through multiple tubules and reaches the outside in the form of the semen sample, it has to travel a lot of distance. So when this tight DNA is exposed to such long journey, and during this journey, if they are exposed to some adverse conditions such as increased oxidative stress, it leads to that DNA getting broken at places. So if the DNA is broken at multiple places, this is what we call as a fragmented DNA. So, how much is the fragmentation or how much breakage the DNA of the sperm has suffered is what we calculate when we test the sperm for DNA fragmentation index. So, what could be the reason? So, if you suppose see a sperm which looks normal when we see it under the microscope, it does look normal. But to give a lay word example, if I drive my car at least 200 kilometers, then I might look physically okay, but then mentally I might be exhausted. So I don't have the energy to do any substantial work once I have reached after driving for this long distance. So, exactly in that way, if a sperm has to travel such a long distance to reach outside or the genital tract of the female, the particular fertilization process which the sperms are expected to perform might not be able they might not be able to do so effectively, and a damaged DNA when it fertilizes an egg, it does result into, it sometimes may not result into a pregnancy at all, but when it does, the pregnancy is not strong enough to continue beyond a certain point, and it leads to recurrent implantation failures and miscarriages. So these are the things that a raised DNA fragmentation index creates. So what are the reasons basically? So there are a few indices which shows that what is the DNA fragmentation index. So to put in simple words, like we explained, this is the energy of the DNA that is conserved in the head of the sperm, and that is basically the unit which fertilizes the egg to form an embryo. Now, what could be the causes of a raised DNA fragmentation index? So, like we discussed, that the increase of oxidative stress during the process of spermatogenesis is what leads to a defective DNA and DNA fragmentation. So, during your lifestyle or during your this 60 to 80 days, what are the things that uh, contribute to raising the oxidative stress? So, first and foremost is obesity. Obesity, when it's combined with heavy physical activities like whatever generate a lot of heat in your local region or groin region. So, those things definitely it leads to a higher DNA fragmentation because sperm production takes place at a lower temperature than our normal body temperature. So, core body temperature, if it is around 37 to 38 degrees, the sperm production, it will happen at around 35 to 36 degrees. So, a 2 to 3 degree of temperature, it needs to be reduced for effective spermatogenesis. So heat exposure. Due to your occupation, due to your job profile, you might be exposed to a lot of heat. So Indian climate is a temperate climate where maximum time we are exposed to a lot of extremes of temperature, and excess of heat is negatively it's going to affect the spermatogenesis. So when there is a lot of heat generation or heat exposure, maybe because of your occupation or due to your climatic conditions, they also contribute to a raised DNA fragmentation. Another is if the diabetes is uncontrolled or the hypertension is uncontrolled, that also can lead to a raised DFI. Other things are like smoking, drugs, alcohol, or exposure to tobacco chewing, substance abuse. All those things also negatively impact the spermatogenesis. Uh, Another thing which has increased nowadays is exposure to pollution, radiations, and cancer or chemotherapy drugs. So, all these things contribute to raising the DNA fragmentation index. Some local and systemic infections, when they are persistently present, also can lead to defective spermatogenesis, leading to a defective DNA. So, how do we diagnose? How do we diagnose the raised sperm DFI? So, like we said, the most impactful indicator is the history. So, in the history, if everything is fine, there are no parameters which would suggest to us, or if there are some mild parameters, but in spite of that, in spite of some effective treatment happening, the conception is, however, it's not occurring. Or if there are recurrent IUI failures, recurrent implantation failures, or recurrent abortions, where there is no particular cause which we can point out to the failure of the pregnancy. So, in this scenario, we have to suggest the couple to undergo a sperm DNA fragmentation. Now, this is an advanced test and it is done in various methods. So, the two commonly used methods are tunnel test and sperm chromatin dispersion. So, various labs follow various protocols of doing these tests. Now, the test results, once they come, we are as clinicians, we interpret those test results and we come up with a effective treatment depending on that test. So, a sperm DNA fragmentation index of less than 15% is what is desirable. So, some amount of breakages in the DNA are bound to happen because of this long transit from the site of production to the semen. So up to 15% of DNA fragmentation is what is acceptable, but beyond 15%, if we do find a DNA fragmentation index, then it is again categorized up to 45 or 55% of DNA fragmentation, and particularly depending on what is the degree, we decide what kind of treatment would be effective in that particular couple. The raised DNA fragmentation index, it basically reduces or impacts your chances of successful pregnancy in IUI as well as IVF. So it is very important when you have unexplained infertility to go ahead for your sperm DNA fragmentation. So once a raised DFI is diagnosed, how do we treat it? So there are a few things that will be advised to you by your doctor. So, any underlying cause, if it is found that it could be one of the factors which is contributing to a raised DFI, then that underlying factor needs to be addressed and treated accordingly. So, if there is obesity, you are advised to lose weight. If there is diabetic control is not good, then a good diabetic control or a good hypertension control is what is advised. Another thing, if you do see that there are some occupational exposures during your day-to-day activities, like you're using a lot of laptop, a lot of mobile cell phone exposure is there, or you're working in some factories where a lot of the temperature is quite high. In those scenarios, of course, it's not possible to change one's occupation, but then to use loose undergarments, use cotton undergarments which are breathable, can help in reducing the temperature. Another thing which you can do at your end is scrotal bath. So, what is a scrotal bath? Because you have been exposed to a lot of heat during the day, at night times you can use tepid water from your tap and take a sink or a bowl in which you can sit with your scrotum dip, and this is going to effectively bring down the temperature during night time so that night spermatogenesis can occur better. So this is something that you can do. Another thing, if there are some effect in some habits in your lifestyle, such as smoking addiction, tobacco chewing, or alcohol, those things you should curtail down and completely avoid until a conception happens healthily. Another thing is to focus on your diet and sleep cycle. So diet, if it is a lot of preservative based or lot of junk food is being consumed, then those things should also be reduced. One of the things is varicocele. So what we see in practice is varicocele. To explain in simpler words, varicocele is swelling of the blood vessels which are supplying to the testes. So as a result, this the temperature of the scrotum is raised because there is stasis of the blood for a longer time in the scrotum. So because of this, the temperature is raised. There is whatever oxidative free radicals are generated have direct impact on the spermatogenesis, and it also leads to raised DNA fragmentation index. If it's long standing, it will reduce your sperm count and motility even. So if there is found to be a varicocele of grade 3, grade 4, then in that scenario, a microsurgery to repair the varicocele is also advised. However, along with these things, your doctor or your caretaker, your clinician will also prescribe to you some vitamins, some antioxidants, which are found to improve your DNA fragmentation. So, vitamin C, vitamin E, these are very powerful antioxidants which will be supplied to you or prescribed to you by your clinician. Along with this, some coenzymes, some amino acids, lycopene, all these things were also found to be effective in reducing your DNA fragmentation. So, generally, this course of medications or course of treatment, where we are not going too far or it's not far fetched, is usually tentatively fixed for at least 2 to 3 months. At the end of 2 to 3 months, we do assess the DNA fragmentation again, and once we see there is a significant improvement in the DNA fragmentation, then accordingly depends on how much the improvement is, we treat according to the plan of line of treatment. However, if we see that there isn't much improvement in the DNA fragmentation, and along with a raised DNA fragmentation, if there are some other factors which are on the female side, or there are some tubal factors, if such case comes up to us, then we do not waste much time in rather improving the DNA fragmentation rather than going ahead for an IVF treatment or an advanced IVF treatment. So, depends on what other factors are there. You will be advised an IVF or an ICSI treatment. So, in IVF treatment, if the sperm count is good and if the female factors are not much, the reserve of the lady is good, then we can go for a conventional IVF, but ICSI is more preferred. So, what happens in ICSI is we take the stimulated eggs or the mature follicles from the female, and we inject a good quality sperm that is being selected by different methods, and we inject this single sperm in the single egg to form an embryo. This embryo is then cultured till day 5 and frozen for subsequent embryo transfer. So, even during IVF, someone might encounter that yes, the yield was good, the number of eggs was good, it was a mature follicle, the yield of sperms was also good, but there is arrest of your embryos. So, embryos are unable to develop from day 3 to day 5. So, there are less number of day 5, or blastocyst conversion rates might also be less if the DFI is raised. So in this scenario, the doctor or the clinician might advise you to go for higher sperm selection techniques. So if the count and motility are good, then you might be advised to go ahead for a microfluidic method for sperm selection in ICSI. Apart from this, there is MAX, which is magnetic cell sorter, which sorts out the damaged or defective DNA sperms and selects only the good sperms which are then available for your ICSI. If along with not just the DFI being raised, but along with that, if there are some other factors like some counts are also less. So there is oligospermia also, along with a raised DNA fragmentation. Then, depending on the case, we might also advise you to go ahead for testicular sperm extraction. So, like we said, that the site of production and the site of collection, there is a lot of transit happening for the sperm between these two sites, which again makes the sperm vulnerable for oxidative damage. So rather, taking the sperms from the sample, so rather than that, we source the sperms from the site of production itself. So we, like we do for the follicles or the ovaries, we take the eggs directly from the site of production. Similarly, can be done for the male partners also, and we can source these sperms directly from the testes to be used during an ICSI, which we call as testicular sperm extraction. And there are various surgeries involved in this, like microtessa, tessa, and everything else. So these are the plans which can be employed even when a DNA fragmentation is raised, in spite of your routine conservative treatment. And proper case selection of couples to undergo an ICSI with advanced sperm selection techniques is definitely bound to give you a desirable result, where a successful pregnancy implantation and continuation of that pregnancy giving you with a good and healthy child is definitely possible with the right kind of treatment. So this was today's topic of raised DNA fragmentation index and the treatment options available for the same. So if there are any questions depending on this session, you are free to ask them. So what are the risk factors for a high DNA fragmentation index? This is our first question. So if a DNA fragmentation is raised, so risk factors that make you vulnerable, that you might have a raised DFI, are first of all a faulty lifestyle, where you are not working out, you are not eating healthy, you don't have a fixed sleep schedule. Your occupation involves a lot of mobile or laptop exposure, a lot of radiation exposure is there, exposure to tobacco smoke, maybe active or passive, lot of binge drinking is there. So all these things definitely make you at high risk for raised DNA fragmentation index. So try to curtail on those things, and those things, if they are taken care of effectively at the right time, they will allow you to bring your DNA fragmentation back down. So another question is that, can lifestyle factors or temporary conditions affect my DNA fragmentation results? Yes, definitely. So lifestyle factors is what we just discussed. Another thing is temporary conditions. So what are the temporary conditions that are found to affect your DNA fragmentation index? So there are some infections which may be somewhere else in your body, or locally maybe some pyocele is there, or some varicocele infection is there, some urine infections have happened, prostatitis has happened. So all those things in male genital system, in male reproductive system, if there is some infection, or during a semen analysis, we see that okay, we are observing some sort of infection, then treating that infection might also help in bringing down your DNA fragmentation. Another factor, like we discussed, the varicocele. Varicocele to certain extent is something that we might find when we are evaluating the male partners for infertility. But there are some methods, treatment methods, maybe conservative or surgical, which can be done and can bring back your DNA fragmentation index. If there are any more questions regarding sperm DNA fragmentation, or other than the sperm DNA fragmentation index, if there are any other concerns regarding your fertility, or you want a consultation, or you have to clear your doubts, please do give us a call on the helpline number mentioned below. So this is me, Dr. Sneha, signing off from today's session. Thank you.